Sound therapy helps us to pay less attention to our tinnitus. It's about distracting our brain and allowing our brain to be listening to something else instead of constantly tuning the tinnitus in. Now, for some people, distraction isn't necessarily what's happening. For some people, it's about changing the neuroplasticity of the brain. We don't understand why a certain percentage of people with tinnitus find it incredibly difficult to take their attention off of the tinnitus onto something else. And it's those people that have the real troublesome tinnitus. We don't understand why a certain selection of the population have this problem, because most people will find sound therapy very quickly helps them to distract, and the less attention they pay, the volume of tinnitus then comes down. And this continues to then get better and better over time. But there is a very small percentage of people where this really takes a lot of hard work to get there. And those are the people that we need to change the neuroplasticity of the brain and take the attention off of it and onto something else. So in a way, if you like, there are two types of tinnitus patients. There are those patients who very quickly and very readily can use music and sound therapies such as NAP for distraction and very quickly reduce the level of their tinnitus. And there are those patients who we actually have to be changing the pathways in the brain because for some reason they've changed and their attention is paid very much on the tinnitus, and they're find it very difficult to take that attention off. So those patients that are particularly troublesome, that would find sound therapy incredibly useful, but usually then alongside some counselling as well. So those people with really troublesome tinnitus, they need a bit more support. Sound therapy is at its core, but counselling goes along with it. Most people with tinnitus that perhaps just disturbs them at night, or very mild tinnitus, just using sound therapy themselves by getting an app and downloading it and listening to different sounds at night time or whenever it's bothersome would just be enough to distract and reduce then the level of the tinnitus. So it's those troublesome patients, those patients that find it incredibly difficult to take their attention away, that sound therapy is incredibly useful, but it has to be worked at a little bit harder and used for longer, and generally works much better, as I said before, alongside some counselling. So if you look now at what might be useful for you, with sound therapy, if it's nighttime you're having a problem, think about getting a sound pillow so you can play any of these sounds that you want to listen to through a pillow at night, or you can get a little device called a white noise generator from an audiologist or a hearing therapist, which are great, and they would be able to issue you with something that goes into the ear and plays another sound. That can be incredibly useful. It seems a bit strange to some people, but for others it's an incredibly useful tool. So I hope that explains a little bit about what sound therapy is and how you can use it. You know, there are different levels of needing to use the sound therapy. In other words, some people find it, they just use it as and when they need to. But for some people, when you're really going into a strict regime of trying to retrain your brain and change the neuroplasticity of the brain, then you may need to actually do that for certain periods of time, and often up to 8 hours a day, and that can include overnight. So, you know, it's about the brain listening to something else and understanding it doesn't need to tune the tinnitus in. So it very much it would have to be tailored to you as an individual, and that's where the counselling comes in alongside. I hope that explains a little bit, and I've not waffled too much, which is what I'm pretty good at doing, and that you get an idea of what sound therapy can do for you and how you might be able to access that. All right, thanks then. Hope that helps. Bye-bye.